Hi, everybody. Welcome to today's webinar, brought to you by Diagnostic Solutions Laboratory and presented by Dr. Daniel Kalish. Welcome, Dr. Kalish.
Thank you for having me back. This is exciting. All right, so we're going to jump in. Today's class is about the functional approach to weight loss resistance that looks at gut factors and metabolomics, or metabolism, maybe easier to say it that way. And what's the relationship between what's happening with the gut bacteria and what's happening with your ability to burn energy or fuel or fat or carbs? That's kind of the connection we're trying to make today. And in fact, I do it with every patient workup, and you should be doing this too, you should be ordering a GI-MAP and an OMX. And if the OMX is overwhelming, you can be ordering a GI-MAP and Diagnostic Solutions organic acids. That's another option too. It's a little simpler of a test. Okay, this is about me. And we're going to talk a lot about Richard Lord's work today and the work that he's trained me in as well. And we're going to talk about OMX, and we're going to talk about GI-MAP. And we want to understand how the inflammatory / oxidative stress / insulin resistance markers on the GI-MAP, on the OMX, can tie back to the inflammatory / microbiome markers on the GI-MAP. So we're not really talking about infections today. We're more talking about commensal bacteria and the microbiome itself. And people look at this in different ways. You can look at this as there's an infection, there's a SIBO problem, we're going to eliminate all these bad organisms, and then everything is going to be okay. And then there's the attitude of the reason why these bad organisms are there in the first place is because the microbiome, the good organisms, are underperforming, let's say. And so in a way, a more basic and yet at the same time more sophisticated way of addressing GI issues and a damaged metabolism is to strengthen the commensal bacteria and to deal with the polyphenol markers and fix the metabolism itself through the OMX panel, but then at the same time to fix the microbiome on the GI-MAP. And in fact, Dr. Richard Lord would say, I know he would say this because he has said this hundreds of times to me over the last 12 years, really you should start with the microbiome correction, Dan, and back off on all these antimicrobial herbs that you're doing, and back off on the SIBO thing. He just shakes his head when I say SIBO. He's like, it's not about the infections, kid. It's about the host and the host's immune response and the host's microbiome. So as we get older in this profession and we do this job longer and longer, we get both simpler in our approach and more nuanced and sophisticated all at the same time. So the sophisticated, nuanced way to deal with this is to look at the GI-MAP, to look at the markers that are related to the microbiome and the digestive organ functions, like is the pancreas working well, is the gallbladder working well, do you need digestive enzymes or gallbladder support, do you need polyphenols, do you need fiber, getting that whole system working in terms of the microbiome, and then taking a deep breath and seeing if the yeast is still there, or if you're running a SIBO test with another lab, is the SIBO still there? It's probably not going to be, okay? So we're looking at the underlying cause for a lot of these digestive problems. And then at the end, we have a slide or two on how dopamine just makes people go crazy with their diet, and there's a really strong association with dopamine problems and gut problems. And also I've got some extra special slides on CoQ10 and how that works in regulating metabolism. So if I want to just talk about, forget about the slide for a second, we're going to talk about the bigger picture for a moment. So you've got your metabolism, which we're thinking about mitochondria breaking down protein, fats, carbs, but mostly fats and carbs to make energy or fuel. Hopefully the protein you're eating is going towards repair and other kinds of things, primarily, right? And so that whole process happens in the mitochondria. And if the mitochondria are not working well, you're not going to be able to break down and make energy out of fat and carbohydrate from your diet. And then you're going to get fat and you're going to have unstable blood sugar and you're not going to feel very good about yourself or the world in any way. And so the secret weapon here in a lot of ways is getting the major metabolic functions to work properly, including a few heavy hitters that make the mitochondria work. And so there's sort of a call and response thing that Richard Lord does with me on calls, which is kind of sounds stupid now that I'm saying it, but he'll say mitochondria and then I'm supposed to say something back. It's kind of like if you're at a football game and they say Panthers and you say go Panthers or whatever. So he says mitochondria and I'm supposed to immediately say magnesium, CoQ10, and oxygen. So we want to get that down. So I say mitochondria or I say metabolism, you should think magnesium, CoQ10, and oxygen. Now, oxygen is the oxygen that we breathe. So breathing exercises are going to help people lose weight, obviously, right? In fact, where does all the fat go? When you think about it, when you're burning off body fat, how does it get out of your body? It's a whole, fat is these huge long chains of carbon. Where does the carbon go? Does anybody know? I wish I could see you guys and you could put your hands up. Anybody want to raise their hand on that one? Type it into the little box there if you know what the answer is. Where does the fat go? It comes out as carbons, but how does that exit the body? In the form of carbon dioxide when you breathe out. So you're like literally breathing out the fat as you burn it. There's no other way that I know of that the fat can get out of your body, really. You know? So breathing is really important. Breathing exercise and obviously physical exercise so that you're breathing more. Because you breathe more, you're breathing out more carbon and you're burning fat as you do that. You know? That's where the fat is exiting through. But from a supplement standpoint, a lab interpretation standpoint, we're talking about magnesium and CoQ10. So I say mitochondria or metabolism. You think magnesium, CoQ10. And without those nutrients, magnesium and CoQ10, metabolism shuts down. Now, you don't really think of, and I don't think of magnesium and CoQ10 as like weight loss products, because when you give them to people, they don't lose weight. But they're their prerequisite to the person losing weight. They come before the weight loss part comes even. So if you think about like, I don't know, like if you're listening to your favorite rock and roll band and most people don't identify with the bass player. The bass player is just in the background there doing his or her thing. But really, if you're a bass player, as I was years ago, you primarily listen to the bass player because you know they're holding the whole band together, but they don't get a whole lot of credit. But every great rock band has a great bass player. That is for sure the truth. So with metabolism, CoQ10 and magnesium are like the bass player. They're in the background. You give them to people, they don't lose weight really fast. That's not going to happen. But if they're not there and the mitochondria aren't working, everything else you do for weight loss is going to be a complete waste of time. Okay, so they're the sort of unsung heroes of burning fat. And we're going to look at on an OMX and on a GI-MAP how you can see from commensal bacteria and from the metabolic markers on the OMX if that system's working or not. So again, this is like a prerequisite or a prequel to getting fat burning to work. And if you're doing programs with people and they're not losing weight, it's very likely that they have a magnesium or CoQ10 problem, their mitochondria is screwed up and their microbiome screwed up, and that's part of why it's not working. Okay. So on the GI-MAP, you have these markers for inflammation like calprotectin and zonulin. And on the OMX, we're thinking about markers like oxidative stress markers and the mitochondrial markers, which we'll look at in detail, okay? And of course, oxidative stress is bad for you in general in terms of heart disease, cancer risk, diabetes, and all that other stuff. So there are these markers on the OMX that parallel markers on the GI-MAP, and they are the polyphenol markers on the OMX. So if you're taking notes, you should write down polyphenol and underline it, because that's the important main word for this whole talk. What are they? Everyone's heard of polyphenols, right? Commensal bacteria feed on polyphenols from your diet. So polyphenols, for the most part, have a large molecular structure, most of them, and your body cannot pull them across the intestinal tract lining. They're in your gut for the gut bacteria to use the polyphenols as a food supply, okay? And when you eat polyphenols, you're not eating them for yourself, you're eating them for your gut bacteria so that they can grow and proliferate. And then they do a whole bunch of really important and good things for you that are key. You can see the commensal bacteria measured on the GI-MAP. Those are the good bacteria. Those are the guys and gals that are making good stuff from the polyphenols. And the good stuff are the polyphenol markers on the OMX test. Okay, so you can actually see this in real time. Are the commensal bacteria there? Yes or no, GI-MAP tells you. Are the polyphenol markers that are related to those good gut bacteria high or low or in a good range? You want them in a good range. You don't want them high because that would indicate dysbiosis, too much of a bacterial overgrowth. And you don't want the polyphenol markers low because that means the person's not eating enough polyphenols, and then their metabolism is going to be wrecked. Okay, we could probably just stop at this slide and start to look at labs because this is really the whole thing I'm trying to talk to you about. So let's get a few more slides in to see if this can sink into your brain for a minute. This may be a new concept to you. Commensal bacteria, GI-MAP, look at them. If they're screwed up, you've got a problem, okay, with potentially not enough good bacteria to grab onto the polyphenols and to turn them into the stuff that your body needs. And the stuff that your body needs show up on the polyphenol markers on the omics. How crazy is that? I'm going to skip some of these slides so we have time for labs, but there's Akkermansia, and this is everybody's favorite commensal bacteria these days. But I have to tell you, like 10 years ago, this was my favorite. I was way into Akkermansia before anybody knew what it was, but it's like all that everybody talks about now. So it's a super important gut bacteria. It's measured on the GI-MAP, and it grazes on the mucus lining of the gut surface. It's kind of like a lawnmower. So it's chewing up mucin, mucinophila, you see the name of it, mucin lover. Like Philadelphia is a city of love. Phila is love. Mucin is mucin or mucus. So it loves mucus. It eats up the mucus lining in the gut, but it does it in a way that encourages growth and healing and repair, not in a bad way. And it's preventing leaky gut. It's keeping the gut lining healthy, basically, keeping inflammation at bay, strengthening the immune response. It's a very, very, very important commensal bacteria. And you see high levels of Akkermansia in thin people, and you see less of it in obese people. And there's all kinds of studies on this. If you want to get into it, it's really quite interesting. I just have to warn you, you could spend a lot of time on this. I spent like 2 years looking at this stuff with Richard Lord. But it's pretty cool. So functions of Akkermansia mucinophila and type 2 diabetes and related diseases. So clearly it's related to metabolism because type 2 diabetes is sort of the ultimate failure of our metabolism. Oh, this is a brand new study. It just came out a few months ago. It was a review article. There's lots and lots of research on this. But in this one, you can see, there's a quote from this article here, okay? You can see insulin resistance. Well, they say Akkermansia mucinophila treatment improves host metabolism, which is exactly what we're after, right? Insulin resistance and metabolic syndrome are the most prominent characteristics of type 2 diabetes, and Akkermansia alleviates metabolic syndrome by improving glucose, lipid, and bile acid metabolism. Crazy that that's possible. What they're saying there is that Akkermansia improves your metabolism. If it's low, it screws up your metabolism. It does all these other things too. It's another diagram from that article. It does tons and tons of things in terms of cognitive impairment, reducing cognitive impairment, making your liver healthier, making you less overweight, helping your blood sugar stabilize, reducing your risk of heart disease and all that, okay? So if you have high Akkermansia, your brain is healthier, your liver is healthier, you get skinny, your blood sugar is better, and your heart is better. Pretty important. And so to increase it, you can see here they have polyphenols. That's like what we're talking about today because that's something that we can measure easily. And you're measuring it already if you're doing the omics test. Just have to show you what the markers are. So again, another article, commensal bacteria at the interface of host metabolism and the immune system. And these are major medical schools that are studying this stuff. From that article, recent studies have highlighted that alterations in the composition of commensal bacterial populations are linked to multiple metabolic and inflammatory diseases in humans, including but not limited to IBD, obesity, type 2 diabetes, atherosclerosis, allergy, and colon cancer. That's a pretty long list of bad things that can happen if you don't have the commensal bacteria. So the GI-MAP test, honestly, like, for most of us, when you look at the GI-MAP, you're looking, oh, is there H. pylori? That's what I always look for first. Oh, is there yeast overgrowth? Oh, I know what to do about that. Giardia, yikes. But when you look at the commensal bacteria, do you really get super excited? No, you don't, because it's confusing and you don't really know what all those markers mean. So we have to sort of dissect this and start to see what are the patterns with the commensal bacteria, because that's ground zero for treating the microbiome. And again, another little diagram here from that research article on digestion, metabolism, immune system, and the commensals. So we want to master the commensal section of the GI-MAP. That's the goal. And you want to correlate that with the OMX test. And I'll show you that at the end of the class when we review some labs, okay? So commensals break down complex carbs, and they turn fiber into fat. I'm pausing now because it's hard to wrap your mind around the fact that we eat polyphenols, okay, you can kind of get that, and the gut bacteria feed on them, and they make these metabolites, which turn out to be incredibly important for your metabolism. So when you eat the polyphenols, the gut bacteria feed on them. The byproducts of that process regulate the most important nutrient for your metabolism, which is CoQ10. Okay, CoQ10 is regulated by polyphenol consumption. I'm not making that up. I have some slides on it. Just wait, give me a minute and we'll get to that. And secondary to the polyphenol issue is the fiber into fat thing. Like whoever thought of that? These gut bacteria, you eat fiber that you can't digest. You're not a cow. You can't digest this fiber. And the gut bacteria are like, oh, yeah, we could deal with this. We're going to take that fiber that Dan just ate and we're going to convert it into fat. Fat. They take fiber and they convert it into fat. You try doing that. That's like a weird thing that bacteria can do. It's like a party trick for gut bacteria. And we call them short chain fatty acids, but they're fats. Just like every other fat, they're a fuel. And to make it crazier, they're a signaling molecule. A signaling molecule. These fats tell your body to do stuff. Most important and famous of them is probably butyrate. And when butyrate, which is a fat that the bacteria in your gut make from fiber, so you eat the fiber, the gut bacteria get a hold of the fiber, they turn it into fat, that is butyrate. When that butyrate hits your brain, it stimulates the release of something called BDNF, brain-derived neurotrophic factor, and it causes brain cells to grow. How crazy is that? Plus, you use the butyrate in your gut for all kinds of important processes. Super, super important, and you only get it. You're not eating butyrate, you're eating fiber. It's the gut bacteria that are making the butyrate for you. So the polyphenols turn into metabolites from which we make CoQ10 and other things. The fiber that the gut bacteria need turn into these fats that are the main fuel supply. It's like 60+% of the gut energy, the energy that the gut cells use, comes from short chain fatty acids. And that comes from you eating fiber, not from you eating fat. And obviously eating fiber doesn't make you fat. Everybody knows that, you know. I think that's kind of intuitively obvious, but in case you're not going to eat a lot of fiber and then make a lot of fat and get fat from that. It's quite the opposite. So 3 stages of GI dysfunction. I've got a lot of talks on this, but just to briefly say, we're focusing on the microbiome part of this, or stage 1. Because you get that right, the other things can start to improve. And in addition to supporting the microbiome with prebiotics and probiotics, right? Things like fiber and polyphenols, you can and probiotics. You can also use things like pancreatic enzymes and gallbladder support. So you have better breakdown of foods in the small intestine. So it's really like microbiome correction along with some organ tuning up prior to doing all the killing stuff. And again, restating what I just said, the microbiome is important. We're talking about metabolism and preventing diabetes, but also for preventing cardiovascular disease, various forms of cancer, even hormones, right? Beta-glucuronidase, if that's high, it's a hormone-related problem that's coming from a gut bacteria imbalance. So the gut is really where it's at. The naturopaths knew that a super long time ago. Healthy microbiome keeps the GI mucus layer healthy. If you have good gut bacteria, you will not have leaky gut. I don't think those two can coexist. I've never seen it. I don't think it's possible. If you have good gut bacteria, by definition, they're taking care of the gut lining. They're keeping the inflammation and tissue damage away from the gut lining. If you have poor commensal bacteria numbers, then your gut is just a target for inflammation and tissue damage, and it's going to get damaged and leaky. So this is my quiz. Again, if we were live in an audience, I'd ask you to put your hands up. So you could like put your hands up and just in spirit here. How many of you order stool testing in your practices? I'm thinking every hand just went up because you guys are at a GI-MAP webinar. But how many of you order stool tests for every new patient? Okay, if half of you guys just put your hands down now, that's not acceptable. To do a proper functional medicine workup, you have to order a stool test and an OMX test on every new patient. And I know that seems overwhelming, but I want to get our whole profession to that point where that's just kind of obvious. Okay, just obvious. It's just obvious that you should be doing that. And people say, oh, what did you do with your functional medicine doctor? Oh yeah, we did a GI-MAP and an OMX. Like, oh yeah, I did that too. Okay, different doctor, but oh yeah, it's just kind of what they do, isn't it? Yeah, that's the warm-up testing. That's the basic introductory stuff. Okay, now here's what I promised I would talk to you about. This is where we're going to get a little more serious, right? And I'm going to pick a color. I don't know why I always use red. It seems like it stands out better. And now we're thinking about microbial metabolites on the omics. Microbial metabolites on the omics. All right. And you see here, it says polyphenols, microbial metabolites. So we're talking a lot about polyphenols now. These markers here go up in response to polyphenols. If they're too high, it can indicate too many gut bacteria and there can be dysbiosis. So they're often thought of as dysbiosis markers. But guess what? If they're low, underneath detected limit, DL means underneath detected limits, low, that can mean what? That there's not enough polyphenols in the diet. Not enough polyphenols in the diet. So these polyphenol markers are a response to you eating polyphenols and then the gut bacteria feeding on them. So if they're low, it's an indicator that there may not be enough commensal bacteria. And then you can reinforce that by looking at the GI-MAP and see if you can see it on that test as well. And then one of these markers, 4-hydroxybenzoic acid, is super important. It's so important for metabolism. And again, I'm asking the question on our system here. Raise your hand if you know why 4-hydroxybenzoic acid is the critical thing for metabolism. Anybody know? Because your body needs it to make CoQ10. It's the final step in CoQ10 production. Can you believe that? This marker right here, 4-hydroxybenzoic acid, is the final marker in CoQ10 production. Now you can make it in your body independent of the gut bacteria, but you need it. You need to be able to make it also from eating polyphenols in your diet. So you eat the polyphenols, this marker goes up to the normal range, and then you can make your CoQ10 and then you can burn your fat. Okay, so if you don't have enough of this guy and you don't eat enough polyphenols, you don't make CoQ10, and it's like taking the bass player out of the band. It's like, okay, how fun is it to go see, you know, the Rolling Stones if there's no bass player? Just be Mick Jagger up there like wailing away and be like, hey, what happened to the rhythm section? You know, this is like a background player, but it's super important. And I've got some more slides on it in a minute. Again, microbial metabolites, you want to start to think about this. And you don't really need to memorize them all. You just need to know that they're a group. Benzoic acid, hippuric acid, 4-hydroxybenzoic acid. Just think of them as what happens when you eat polyphenols. The good bacteria feed on the polyphenols, and these markers go up. They go too high, could be dysbiosis. Not guaranteed, but it could be. Confirm it with your GI-MAP. They don't go high enough, they're underneath detected limit like some of these are, you got a big problem with a person's diet. They're not eating right. And then, again, low polyphenol markers is like, hey, listen, Susie, we got to figure out about more vegetables and fruit in your diet. And do you know what polyphenols are? And here's a list of high polyphenol foods for you to eat. And that's what I call labs to lifestyle. Where you see the lab and you go, oh, wait a minute, you got to fix this. We can give you, and I'm going to give you polyphenol supplements. Yes, of course, we're going to do that to get you better fast. But the long term, we don't want you taking this stuff for the rest of your life. And that my old joke was, I don't want you to put my kid through college buying supplements from me. But now my kid is through college, so I haven't come up with a new joke for that one yet, or a new line. Like, I really don't want to sell supplements. That's not the idea. I didn't enter into this profession so I can make a lot of money selling supplements. That was never my intention. We want to get people to use supplements for short periods of time so they can transition to making these changes with their diet. Okay, and by the way, as a total segue, my son is in graduate school right now, and he's studying DNA and how DNA and chromatins collapse under certain circumstances. He's doing this biophysics degree, which is kind of cool. So low polyphenol markers mean they need to eat more fruits and vegetables. So we're talking about root cause medicine. I think you guys are already on board with that. Make sure you just test everybody for this stuff, okay? And let's look at polyphenols, what they can do, all these super fancy things. We're talking about sort of a niche area of them, but just to also blow out the bigger picture, they can help with all kinds of other aspects of the overall health of the human being. And then here's what I was promising you. So remember we just saw that marker about a minute and a half ago for 4-hydroxybenzoic acid, or it's sometimes written out as 4-hydroxybenzoate. Same thing, benzoic acid and benzoate are the same thing, depending on which scientific paper you're looking at or whatever. That is the precursor, the direct precursor to making CoQ10. And CoQ10 is the most essential thing so that you can make energy inside the cells. This marker here is on the lab, it's on your OMX test, and it tells you if the person's eating enough polyphenols or not. You need those polyphenols because you need this stuff to be able to make CoQ10. Now again, you also can manufacture 4-hydroxybenzoic acid or benzoate on your own, but your body doesn't make enough of it. You need the polyphenols for this metabolism thing to work properly. And if you want to go further up the chain, how do we actually make CoQ10? Well, you start with acetyl-CoA, you convert it down here, and there's a medication that's commonly used in the United States, a group of medications, the statins. They block the production of cholesterol by interfering with this enzyme right here. So if you have a patient that's on a statin, you want to double check this and make sure that their CoQ10 levels are adequate, okay? Because in the process of lowering the cholesterol, sometimes it may be interfering with CoQ10 as well. So that's kind of an aside. And again, polyphenols, here's a little diagram of the foods. They go into your mouth, they go into your gut. The gut microbiome, the good gut bacteria, feed on them. They have anti-cancer effects, anti-diabetic effects, this is what we're talking about now, metabolism, right? They're anti-inflammatory, they help your brain, they help your heart. They're very important. And these polyphenolic metabolites are, let me just go back a page here, are these markers. And they're called out on the lab. It's pretty clear. Polyphenol microbial metabolites. There they are, right there. Okay, those guys. Those guys are really important. In general, though, these markers have been accurately categorized as being dysbiosis markers, but that's only true if they're categorically high. If they're low, like on this test, then they let you know that there's a problem with the commensal bacteria not getting the food that they need from the person eating the right stuff. And again, it's just important, right? This protects your heart, your brain, reduces inflammation, improves your metabolism, and improves your immune system so you can fight cancer off. And so they have a lot of different names: benzoate or benzoic acid, hippurate or hippuric acid. Some of them have phenol in the name, the polyphenol markers. So phenylacetate, phenylpropionate, lots of different names. You don't need to memorize those at all because they're grouped together by section. High markers can mean that there's dysbiosis. Low markers mean there potentially not enough polyphenols in the diet. And then treatment-wise, we want to now think about this polyphenol thing. When do you want to supplement with polyphenols? When do you want to supplement with fiber? Okay. And now just to reiterate on the fiber thing, in case you haven't seen this before, I'll just mention this is the mechanism by which this happens. So we eat the dietary fiber. Our good bacteria go, oh, thanks, Dan, for eating the oatmeal. And then they start to make short-chain fatty acids. Those short-chain fatty acids are super important. You have to have those for your brain to work and your heart to work and everything, right? And then that group of bacteria in the gut stimulate these hydrogen-producing bacteria to start to grow. Now, you don't want excess hydrogen. That's not good, but you need hydrogen and hydrogen-producing bacteria to be healthy. Then what should happen is the hydrogen consumers consume the hydrogen that the hydrogen-producing bacteria made. Well, that's good. So then the hydrogen producers can continue to grow, because if there's too much hydrogen in the system, that screws things up. So you have these different groups of bacteria. Some of them live on fiber, some of them make hydrogen, some of them consume hydrogen, and so on. But this whole thing gets kicked off successfully with dietary fiber and polyphenols. That's how the microbiome works in a nutshell. This is a gross oversimplification, but that's okay. So these are high abundance commensal bacteria. These are ones that help convert fiber to fat. And you'll see some of these on the GI-MAP, like the Faecalibacterium protsnitzii is on there, okay? When we look at tests, you'll see that. So there's some bacteria that convert fiber to fat, and you can just look those up if you need to. And then we've talked a lot about polyphenol markers. I think you guys have got the point there. If the markers are high, you can do antimicrobial programs because there may be dysbiosis present. But if they're low, you want to use the polyphenol containing foods. Okay, and again, here's that same polyphenol section now of the test, which hopefully will be fun now to look at instead of like, ugh, load of drag, I don't really know what that means kind of feeling. So we talked about this a lot. Oh, and then one just last thought before we look at labs, which is that there's this connection between the gut and the brain. We talk a lot about this, but it's nowhere more evident than with dopamine-related problems. So hey, you got the OMX already anyways in front of you. You might as well look at the dopamine markers too, okay? And cytokines and how all that plays a role. And the reason why that's related is because if people's dopamine levels are messed up, then they're just going to eat more food than they need and they're going to get overweight. So if you're trying to get people to lose weight, one of the most effective things you can do is look at the dopamine markers on the test and treat them. And that'll control the appetite and they'll lose weight just from that alone. And the treatments are typically tyrosine and an herbal form of L-Dopa that's called mucuna. And that, again, they're not really appetite suppressants. I think of them as appetite normalizers. And this is really common for people with gut problems to also have dopamine problems. So you just want to think about that too. We'll have time for questions at the end, but I wanted to look at labs first. So let's start here. Here's a case. This is an OMX. Now, pyruvic acid, lactic acid, we're not focusing on that today, but when those go high, obviously there's a blood sugar related problem. And then alpha hydroxybutyric acid and pyroglutamic acid, those are markers for problems with glutathione. Okay, when we look at the mitochondria, we can think more about that. And here's some afters, and I want to show you some other markers here too. You can see them quite easily. Here, let's look at another set of these. So here are the polyphenol metabolites again. You can see how these are high. So that would indicate a potential for dysbiosis. You would go back and look at the GI-MAP and see if there's dysbiosis, that's showing up in the stool test too. So those should correlate. If they don't, you can still treat. So sometimes the GI-MAP may show it, but these markers may not show. Sometimes the reverse is true. They don't always have to correlate. You would treat it if you saw it in either case, but it's nice when things line up. And remember, if the microbial metabolites are low, then you're thinking that they need more polyphenols in their diet. And then one thing that's sort of overarching and super important, one of the most important markers on the whole test probably is 8-OHDG or 8-hydroxy-2-deoxyguanosine. This is an oxidative stress marker, okay? So if oxidative stress is high, that damages mitochondria. If the, let me go back here. These markers here are not good, pyroglutamic acid and hydroxybutyric acid, these are indicators of low glutathione if they're messed up. So low glutathione means mitochondria are being damaged. High oxidative stress means mitochondria being damaged. And then boom, you've got a damaged metabolism. So these are the kinds of things that you see on an OMX when there's a lot of gut problems and the metabolism is being damaged. So that's just, there's so much, ooh, okay, so this is a GI-MAP. I'm assuming you guys have all seen these before, but in case you haven't, this is what a GI-MAP looks like. And we're gonna skip to the commensal bacterial section. And we're going to look at these. And remember, you don't need to memorize this. Some of these bacteria, these are the good bacteria, some of these bacteria are going to be taking fiber and making short chain fatty acids, like butyrate, which is good for your brain, good for your heart, good for everything. Some of these are going to be taking polyphenols and converting them into these metabolites that we measure on the OMX test. And remember, one of those polyphenols is the rate-limiting step in CoQ10 synthesis. So the status of these gut bacteria impacts your brain and your heart and your metabolism. It really, really matters a lot. If you get these gut bacteria balanced, is somebody just going to lose weight all of a sudden? No, of course not. It's not. You know, this is like the bass and the drums in the rock band. This is the backbone. This is the rhythm section. This is in the background. You have to get this fixed though first, and then you can do exercise and diet and lose weight. It's very difficult to get people to lose weight if this is screwed up, if the microbiome is screwed up, or if the mitochondrial markers like CoQ10, like 8-OHDG, like glutathione, if those are messed up, you know, people aren't going to be able to lose weight very easily. Okay, so here's our Akkermansia that we spoke a lot about. Here's our Faecalibacterium prausnitzii and Enterobacter. Some of these are pretty famous. Everyone's heard of Lactobacillus, I think, and Bifidobacterium is pretty famous too. So again, you don't need to memorize what each of these does. It's just conceptually understanding it's fiber that causes these to grow and polyphenols that cause these to grow. So if you see low markers, you want to crank up the fiber and crank up the polyphenols with supplements first, and then move over and start to do it with diet. Okay. And then there's the phyla down here as well, Bacteroidetes and Firmicutes. These are very famously involved in weight loss and obesity as well. There's quite a bit of research on Bacteroidetes and Firmicutes and the balance between them and the ratio between them and how that relates to your metabolism also, okay? In this case, they're both low, which is bad. So that's the commensals. And then, and let's just state what's happening. Okay, they're low. Okay, that's pretty easy. All right, so then let's look at the corresponding omics. And we're not looking at the whole test. We're just gonna kind of skip around, skip down. But I should mention here, just these are obviously the mitochondrial markers and metabolic markers. Okay, so when these markers are all high, you know you have a problem with your mitochondria. These markers like pyruvic and lactic acid high, it's a problem with blood sugar regulation. So we know there's metabolic damage as well as low commensal bacteria. And we're going to want to work on both. And let's go find that one section, which is hunting for it. So much good stuff in here, but we don't have time for everything. I'm sorry. Not there. It's way at the end. Oh, here's our neurotransmitter markers, though. So you do want to pay attention to that. If they have a dopamine problem, you fix that. They won't be as hungry. They'll lose weight from that. And then here's one of our markers right here, 8-OHDG. Okay, if that goes high, it means that the mitochondria could potentially be getting damaged from the oxidative stress that implies. And then here, finally, microbial metabolites. So remember, if these are tending towards the high side, there could be some dysbiosis. If these are tending towards the low side, then it indicates that there's not enough polyphenols or fiber in the diet, right? Especially polyphenols. So now in this case, this person has dysbiosis indicators here, but their microbiome is really in bad shape. So you can have both of those things at the same time, right? You can have not enough good bacteria and an overgrowth of other bacteria. That happens all the time. So let's look at the dysbiosis markers here. Yeah, there they are. So you'd want, in this case, you'd want to treat the dysbiosis first. And as soon as that's winding down, or maybe even as you're doing that, work on the polyphenols and the fiber to get the good bacteria back up. So you want to knock down the bad guys, get the good guys back up. And let's see, let's look at one more example here. Where are we at on time? Oh yeah, we got plenty of time. All right, well, let me actually design a program then. Okay, so what did we just say? That person had, number one, low commensal bacteria. So how are you going to treat that? Prebiotics, and what are they? Polyphenols. You're never going to forget that word after today. Fiber. And then probiotics. And believe it or not, you can actually get butyrate now. Butyrate. Okay, so low commensal bacteria, you can give butyrate, prebiotics, and probiotics. And this makes people feel great, by the way. And then you can add to that, if you want, digestive enzymes and some gallbladder support. So you're really kind of helping the whole microbiome out. And then they also had dysbiosis. So you want to do an antimicrobial program for 2 months to clear dysbiosis. However, if I was Richard Lord, I would say, well, I don't know, Dan, should you really kill the dysbiosis? Is that really what you want to do? If the commensals are low, isn't that the original problem? And I'm like, oh, okay, maybe. What if you just get the commensals back up? Is that going to reorganize the microbiome in such a way that the dysbiosis and the SIBOs of the world are just going to clear up? It might. Do you have to fix the microbiome anyways? Yeah, you kind of do. Is that the underlying reason why this whole thing happened? Probably. So it's not a bad place to start, looking at the commensals and treating them, and then giving that a couple of months, maybe 2 months, 3 months, and seeing how much of an improvement you get symptomatically. And then if you're not all the way there yet, then you've got a much stronger microbiome, and you can go in and kill the H. pylori or get rid of the dysbiosis or take care of whatever else is there. Okay, so you can easily do a low commensal program for the first couple of months, prebiotics, probiotics, butyrate, enzymes, gallbladder support, all those kinds of things. And a lot of patients are just going to be better after that because the dysbiosis will be gone. You retest their GI-MAP, you're like, oh, I guess the good bacteria back up and all those dysbiotic organisms are gone. Problem solved. There's only enough room in your guts to do a certain amount of things. I think it's something like 10 to the 12th gut bacteria can live in a gram of stool. I know somebody actually has measured that, which is kind of disgusting and strange, but it's probably someone's job in a lab somewhere. So there's a finite number of bacteria that can live in your gut. And if the commensals are low, of course, the bad guys are going to proliferate. So it stands to reason, if you get the commensals back higher to their normal ranges, then the bad guys will diminish. So this is another way of doing it. You start with the low commensals, treat them, prebiotics, probiotics, fiber, and butyrate. Wait a few months, see if you got enough done there. Add in the enzymes and gallbladder support. Just kind of hit everything at the same time. And then deal with the dysbiosis later if you have to. And then amongst the probiotics, I break these into 3 categories. One is Sac Boulardii, which is my favorite. And that's just a personal preference kind of thing. I just really, really like Sac Boulardii because it just seems to make everybody feel better. So there's that. And then there's spore-based probiotics. They're super popular and super good. And then there's what I call like the regular ones. That would be like your lactobacillus something or another, lactobacillus rhamnosus or whatever. This is called regular, the old-fashioned kind. So you can use any one of these, spore-based, S. boulardii, the regular kind. You can even use all 3 if you got a more serious case. You can use all 3 at the same time. You can give them S. boulardii, spore-based probiotics, and regular probiotics all together if you want, or pick 1 or 2 of them. If I was going to just pick one, I like the Sac Boulardii as my favorite, but a lot of people like the spore-based ones more, so you might use those and just get results from that. It's not a bad idea, though, to either rotate the gut the probiotics or to use more than one at a time. Totally fine to do that. And you're not doing any killing, right? You're trying to displace these organisms, so using more probiotics kind of makes sense. All right, let's look at one more set of labs, then we'll go to questions. What's going on here? Oh, okay. So now, well, this was a bad one to pick. Sorry I picked this one, but yeah, it's got high commensals. That doesn't really demonstrate what we're trying to talk about. So high commensals, and this is a big question then. Is that a bad thing? Do you want to knock these commensals down? Where it could be that there's some overgrowth. Now you're kind of stuck looking at the rest of the lab. So let's see what else is going on. Okay, so they have a really bad dysbiosis. Well, thank goodness for that. And let's see if there's any other infections. No. Okay, so in this case, you have a couple of options. They have a yeast overgrowth too. I would probably do, and this is a bad lab for me to have chosen, but anyways, this is reality, right? So this is the opposite of what we've been talking about. This is where I think, okay, well, the commensal bacteria, if anything, are overgrowing. So I don't know if fiber, you're going to be able to fiber and polyphenol your way out of this one, right? Because they're already overgrowing. So you probably have to just go in and do an antimicrobial program in this case, okay? And get rid of the dysbiosis first and then retest and see where you're at. And they have a yeast overgrowth too, which may be the bigger problem. So you could do an anti-yeast, anti-dysbiosis protocol first and then come back and deal with the other stuff later. And just for fun, let's take a look at this. Oh, actually, let me go back and this before we go to questions. Let me just tie back one more thing. Remember here, that when I say metabolism or mitochondria, you think CoQ10, magnesium, and oxygen. And that the strange thing about all this is that this is happening here. Is that CoQ10, this is the production of CoQ10. This is how you make CoQ10. You have to have 4-hydroxybenzoic acid to make CoQ10. Your body has some of that around, but not enough. So you need to get some of that from polyphenols. So polyphenols, if they're deficient, are going to undermine your CoQ10 production. You won't have enough CoQ10. Then it doesn't matter how healthy your mitochondria are, and in other ways, you don't have enough CoQ10, the mitochondria aren't going to work. Because the job of CoQ10 is to escort the electrons through the electron transport chain, and there's nothing else that can do that. There's no backup plan. So if this thing is out, it's like a bridge being out to an island and there's no other bridge, right? It's just game over. Your mitochondria aren't going to work. And that's coming about from polyphenol levels, okay? So when you're thinking about metabolic health and you're trying to get all these things fixed, you should do these things simultaneously. So let's just do one protocol thing here and then we can go to questions. So I would do something like this. Let's say you're going to use CoQ10, obviously after all this, right? CoQ10, and I'm not, a lot of it, 100 milligrams. You have to use magnesium with it to get metabolism working. I like the glycinate form, but there's tons of other magnesiums that are great. You have to have B complex in order for the metabolism to work, so you add in the Bs. Some people might add in extra B1 or extra B12 or folate or whatever, depending on what the labs show. And then usually you want to use some free-form amino acids, like 1 teaspoon 2 times a day. And that would be the basic metabolic repair protocol right there, okay? And then in that first case that we had that had the low commensals, you would use a prebiotic powder, 1 or 2 scoops daily. Lots of companies have that, say twice daily. They get plenty of prebiotics. And then some probiotics, let's say spore-based, just to be hip here, spore-based probiotic. And because it's me, some sac boulardii just tossed in there. So we've got prebiotics, probiotics, and then butyrate. And here we have our metabolic program up top to get the mitochondria working and repaired. CoQ10 is also obviously a very powerful antioxidant. So if they have oxidative stress, like that 8-OHDG is high, or if they have glutathione as an issue, you could add here some NAC. Maybe we should add NAC here. I'll just put that in here. That'll take care of the glutathione problem, a couple of NAC twice a day. This would be the metabolic repair part right here. And then this would be the gut repair part there, okay? And that is basically a summary. Okay, so let's open it up for questions.
Okay, can you be more specific about what you look for on the OMX test to determine if someone is experiencing dopamine issues?
Oh, dopamine. Yeah, we didn't really talk about that much. Okay, hang on a sec. So it's pretty straightforward. And let's just try to keep it simple here. So the easiest ways to track that are to look at plasma amino acids. It's a blood test. Tyrosine levels need to be normal to make dopamine. Phenylalanine levels need to be normal to make dopamine. And in terms of metabolic byproducts of dopamine, homovanillinic acid needs to be normal. These are the main markers. So if homovanillinic is out or tyrosine or phenylalanine are out of balance, then you've got a dopamine problem. And then you can use the supplement solution for dopamine. And this really works well. Like I had a whole practice, oops, sorry, I hit the wrong button there. I had a whole practice for like 12 years where this is pretty much all I ever did. Let me find it here. I can guarantee you this works really, really well, like better than you could imagine. You give tyrosine, typically around 500 milligrams, breakfast, lunch, and dinner. It's okay that they do it with food. That's a long story, but it'll still absorb. Don't worry about that part. And then you can do a mucuna-based product. So you do the tyrosine for a week or two first, and if that's not enough, you add in after 1 to 2 weeks, if you need to, a mucuna-based product and give that, and that takes care of most of the dopamine issues. It's a pretty powerful combination. Tyrosine first, if that's enough, stop there. If it's not enough, add in a mucuna-based product. Keep the tyrosine in the program and add the mucuna as an extra, and that'll crank it up quite dramatically.
Awesome, thank you. Next question, how long does taking statins impact results on the OMX test?
I don't know, I think that's all over the map. I mean, some people take statins and are fine. Some people take them and they have, muscle weakness and pain type problems. So I think it's just on an individual basis. Some people take statins and it really makes no difference whatsoever. But it's something you should at least monitor. So as soon as they're on a statin, I would just run the test like once a year and just make sure that their levels are staying good.
Okay, next one. Do probiotics actually take up residence in the gut?
I don't think they do, right? I mean, it's not like you take some lactobacillus and then that organism ends up in your large intestine. I don't think it really works like that. But they impact the gut bacteria dramatically.
Okay. Will the method of just supporting the commensals work if there is H. pylori present, or will that be a losing battle?
That depends on who you ask. So if you asked me that question, which I guess you just did, I would say kill the H. pylori. For goodness sake, just kill it, because it's a personality problem. It's just so satisfying to kill H. pylori. It just makes such a big difference to people. So I always go after H. pylori if there's any remote excuse. However, if I was Richard Lord, he would say, hey, H. pylori can be a commensal. H. pylori can be protective. H. pylori can be good for you. Why kill it? Why not strengthen the microbiome and see? But just based on my clinical experience, getting rid of H. pylori seems to help people so much. That's one that I would go after earlier in the process.
All right. Any recommendations in regards to intermittent fasting in this context?
Well, if the person's healthy enough to do intermittent fasting, then how does that really affect things? Well, it affects the microbiome dramatically, because when you don't eat, the gut bacteria, the commensals drop, their numbers drop dramatically. So the longer that you fast, the more that the commensal bacteria populations decline. And then as soon as you eat again, they're going to proliferate as soon as the food starts to hit your large intestine. So it turns out that cycle of knocking the commensals down by intermittent fasting and then eating again is really, really good for them. Good for you. So there's no problem with doing that. It's just you have to, when you do start to eat again after you're fasted, you have to eat polyphenols and fiber, or it's not going to go so great, right? You don't want to break your fast with like a donut or something. And then intermittent fasting, that's how it affects the gut. Intermittent fasting is one of the most well-researched and well-regarded treatments for mitochondrial dysfunction because of autophagy and all the things that happen in terms of your body cleaning up things, getting rid of old messed up mitochondria, all that. And if you want to stimulate the growth of new mitochondria, so if you want to do intermittent fasting to kind of repair and get rid of all the bad stuff, and again, that's one of the probably most well-documented, what you call it, like longevity thing. And longevity thing means, strengthening of the metabolism, mitochondria. Yeah, going for long periods of time, like eating one meal a day is probably optimum for a lot of people. But most of my patients can't do that. They need to think more about their blood sugar regulation. So I think that's a more advanced idea for patients in general. But yeah, the longer you can go between meals, if you're healthy to begin with, the better, and the better it is for your mitochondria. I don't know how realistic it is lifestyle-wise for a lot of people. And then, of course, you can also do fasts, like water fasting for a day or 3 days or a week or whatever. But again, it doesn't fit in with most people's lifestyle. I don't know how realistic it is to do that. You might have a really long life doing that, but you might not be very happy or have any friends,
Yeah, that one is hard. How will you know if the tyrosine is enough symptoms, or do you retest the OMX in 1 to 2 weeks?
No, it wouldn't change that fast. So you just base it on symptoms, because with tyrosine, when you're cranking up brain chemicals with tyrosine and mucuna, it takes between 5 and 7 days to hit the full benefit of whatever amount you're giving. 5 to 7 days. So you do not assess on days 1, 2, 3, 4. Just ignore those. But you say, hey, I want you to do this, come back in a week, and make sure that you remember or write down how did you feel, days 5, 6, and 7. It takes about that long for the levels to really come up, for the dopamine levels to really come up. So if they're on the product for a full 7 days and there's no response, then they're underdosed. And you can just bring up the dose by adding the Mucuna in.
All right, this is my last question. It's kind of a long one. One of the issues with the gut flora balancing protocols is that most companies are recommending 10 to 15 products which patients are resistant to taking and paying for on top of the cost of testing and clinical care. For this reason, I tend to stage treatment over the course of 6 months to a year, but it takes a lot of convincing when people can get Ozempic prescribed and paid for by insurance and say they will eat better. How do you deal with this issue?
Well, that's a patient communication, patient education issue. So, well, first of all, I mean, some people just are not going to want to do this, and there's no way you're going to convince them. So those people are just kind of out. And then for most people, if they're educated enough and you're, teach them enough about the importance of what you want them to do, then they should be pretty enthusiastic, maybe a little resentful, but pretty enthusiastic about doing it. And if they just don't want to do it, natural medicine is not for everybody. I mean, that's for sure. So I think that at this point in my career, at least, I personally don't feel like I want to try to convince people that these things are a good idea, but I more want to find the people that already think this is a good idea and then help support them. And there's plenty of people that want this approach, and if they don't, then it's fine if they want to go and do these other treatments. It's just not really a good fit.
All right. Well, thank you so very much, Dr. Kalish. We're just about out of time, and I'd like to thank everybody for attending today's webinar. For more information about testings offered by Diagnostic Solution Laboratory, please visit our website. All right, everybody. Thank you very much, Dr. Kalish.
Thank you, guys. Appreciate it.
All right. Bye.